I'm Stine Bringhøj from University College Metropol in Copenhagen. I'm assistant professor in the physiotherapy program. I'm also a physiotherapist myself and visually impaired. I've been a physiotherapist since 1995 and worked in the field of physiotherapy in Denmark for 16 years before I became assistant professor at the University College. I've been in private practice and mainly in the musculoskeletal parts of physiotherapy. Done courses in kinesio therapy, manual therapy, osteopathic therapy, muscle energy, whatever, to meet the patient's needs in private clinics. I've never been unemployed. I always worked on the same equal level as my non-visually impaired colleagues, and I've always also had certain strategy to get employment. Like our French colleague just said, we need to be better than the other, and I think that's something we have to live with, being blind or visually impaired. Always try to be better, better educated, get higher grades, to meet things that we can't do. So I always try to be the best. Yeah, first I would like to show you this slide. That's a map of Denmark, where there's 10 dots. And that's the dots marking the places in Denmark where you can become a physiotherapist. There's 10 places, but 7 university colleges. In Denmark, we educate 1,000 physiotherapists every year on these 10 different locations. And in Metropol, where I work, we have 224 students each year. And in whole of Metropol, which has 17 different educations, we have 10,000 students and 1,000 teachers. In 2012, we were counting how many of the students in Metropol got special education support. And we had 243 students, and most of those students had some kind of mental problem. And then dyslexia was the second largest. Hearing impairments are large as well, and 2% of the special education support went to visually impaired. And that is one student out of 10,000. So we don't have many visually impaired students at Metropol where I work, or we don't know about the visually impaired students. At the moment, in the physiotherapist program, we have one student who is visually impaired, but her vision is quite good, as well as mine. So she bicycles to school, so do I. But it's difficult for her to focus and read small letters and small numbers. The next pictures are of the Metropol University College. This is the gym where we have the students doing exercises, training with large numbers. In each class we have 28 students, and when they are in the gym they take up a lot of room, and they're very happy with the movements. And I can understand if you're visually impaired, it could be very scary to be there in that large setting, large room, which does not meet the settings in the clinical practice. We have very good facilities for studying, but when they get out in the clinical setting, the settings are much smaller. Yeah. The structure of the education in Denmark is that it's a bachelor degree. You study for 3.5 years, and it's a part-time clinical setting and theoretical studying. There's 26 weeks of practical training or internship in the program. The schools in Denmark provides the internships for the students, and each class divides the internships amongst them, so they can get out in hospitals, private clinics, community clinics, even private hospitals. We have internships in, and if there is students with impairments or mental health problems, they don't necessarily go out where they feel a challenge. I work as a mentor for 3 students who are all mentally ill, diagnosed with different kind of mental problems, and they all tell me that they wouldn't like to go out in the psychiatric training because they even themselves have been in a hospitalized with a mental illness, and because they divide the internships in the classes, they don't necessarily have to go. They can tell their student comrades that they don't want to go there, and then others go. And it's very popular to go to the psychological hospitals in Denmark. In Denmark, as Anne has already spoke about a little, we have a system called special education support. We call it special pedagogic support, or special education support, where the students are able to get 20 hours per semester of mentoring from an assistant professor or a teacher at the school. Every semester they need to apply for 20 hours the next semester. Just 3 lines of how the support helps them and what they need support with. I haven't supported any visually impaired students yet, but supported mentally ill students, as I just said. And it's typically something about getting an overview over only the semester or the next 2-3 weeks. What is important to read, what is important to write, what kind of group work is important to attend to, what kind of simulated practical work is important. So I help them with systemizing and prioritizing how to study. This one visually impaired student we have now, I'm in contact with her, but she doesn't, I don't think she has much need for a mentor They also have the possibility of having a secretary. They usually employ one of their students, comrades, to help them with the secretary work, taking notes during classes. One they can work with in the practical settings, that they are safe with, that they probably told that they have a visual impairment. Not all students want to come clear or come open with their problems, and they should come open with their problems or their needs or their impairments when they feel ready. And that gives them problem when they come out in internships, because that's when they need to act upon patients' needs. They can't go and hide. They are usually in small groups of 2 to 5 students and one clinical teacher. So it's very easy to see where the problems are, and it should be easy to address needs there. But the clinical educators, as Annie just added on, has a lot to do. They're both clinical educators, but they're also normal physiotherapists who has patients and do outpatients or go onto the wards. The students also have 70,000 kroners, around 10,000 euros, to get books or other materials made, especially for them. If they need books turned into audiobooks, they can spend some of this money to do so. Also, if they need electric equipment, laser, ultrasound, marked with larger scales, they can do that in the school or the hospital setting. Also, when they start at the physiotherapist program, they are provided with a computer and the software that they need. That goes for the students with the dyslexia as well. Yeah. The students in Denmark go through the same program as the other non-handicapped students, and with the special education support. And if they're open-minded and has a little, what should I say, they can choose their internships, so they maybe don't come out in the large settings. They don't need to go to a hospital. They can stay in the clinics if that's more convenient. But if they don't ask for help or counseling, it can be very difficult to counsel the students. And my point in this talk is that the students, first of all, has to admit that they have needs and define the needs, which can be very difficult because you haven't been in a student situation or study situation like this before. So it's very difficult to know when you need support and when you do not need support. I think most of you have tried to wear your badge walking along a road, and suddenly somebody grabs your arm and wants to follow you across the road because you're blind. And I can do that myself, don't worry. And that's also with the students. Sometimes they don't need support, even though they're visually impaired, and sometimes they do. And they have to define it themselves. And then they have to ask for help. Thank you.